Uh, Heavy lifting, I think, has been done by Dr. Sahu and Chawla. I would be doing a case presentation, a real world experience of the tetrapatal. This is the disclaimer. Talk is sponsored by Lilly. So, here we have a patient with type 2 diabetes and obesity. This is a 31-year-old female, has recently been diagnosed with the type 2 diabetes, but she has a long history of obesity going decade back. So, Miss P, 31-year female, she basically first time visited for the consultation in March 2025. Patient has a history of obesity, PCOS since 2012, almost 12 years. She was diagnosed diabetes type 2 in November 2024, but she was not on any treatment. She was doing lifestyle changes and many things people try to do at home. And then in the 25 March, she was diagnosed with a grade 2 fatty liver and hypothyroidism. And then she presented at the clinic for the further management. If you look at her parameters, HbA1c at that time is 7.2, diagnosis of type 2 diabetes, 5 years, lifestyle management, weight is 82.6 kg, BMI of 29.9, and blood pressure is normal. She is non-smoker, very occasional alcohol intake, but as norm nowadays, has a sedentary life and long working hours, say 8 to 6 p.m., most of the time sitting. So this is a typical patient you see nowadays. Uh, they try initial 3 to 6 months lifestyle changes and everything. And as we discussed previously also, obesity per se is often ignored until unless it is associated with some other disease. Basically, patient does not consult for the obesity or seek treatment. And previously also, there were not much options available. That may be the one of the reason. Patient was she was also hypothyroid. Her TSH was around 16. She was started on the thyroxine, 75 microgram daily. The This is her journey since last 2 years. In 2022, her weight was 77 kg, and over a period of next 2 years, it has climbed to 85. Uh, and ultimately, she landed up with the diabetes. Although she has a history of PCOS and the obesity since 2012. So, as discussed in the previous by Dr. Sahu, obesity basically is a chronic progressive disease and it can be relapsing disease also. Patient can, with the effort, reduce the weight, but often it relapses. So the question to audience here is, what would be your treatment approach to this patient? Pharmacotherapy for the diabetes and HbA1c reduction, or lifestyle and exercise for the weight control, and the pharmacotherapy to reduce the HbA1c, or the third option, lifestyle, exercise, and the pharmacotherapy for both weight management as well as the HbA1c control. Yeah. Third option is very clear now because now we have an option to treat the obesity with the pharmacotherapy. That's the one reason. Once upon a time, and most of the time, what we used to do is when patient comes with the diabetes, obesity, we advise lifestyle changes. We prescribe metformin, start with one drug, and see what's happen next. Uh, But here, the way her weight is progressing, particularly in last 2 years, that is very alarming. So these patients definitely need an intervention. So everybody agrees with that. So what would be your pharmacotherapy of choice? Uh, Start a metformin, GLP metformin, metformin as GLT2 inhibitor. Yeah. Or or is there something we are missing? Because this patient presented in April. And basically, when we discuss with the patients, what are the options to treat you? Uh, we say that was the standard approach. We start metformin, you follow lifestyle. She said, I follow lifestyle for last so many years. Another option was GLP-1, And another is metformin plus SGLT2. That's SGLT2 is basically a reasonable option if we are not talking about this much of weight loss. 4 kg weight loss, yeah, it may be. But is there something we are missing? Because it was, I think, April 25, and patient pointed out there may be another option, GIP GLP-1 combination or tirzepatide. So basically, definitely, if patient is well informed and that is the right option, you have to agree. And this patient, basically, our target was HbA1c less than 6, weight loss more than 10 kg, 10% of more than 10% of the body weight. So she was initially started with the tirzepatide 2.5 milligram once a week. Uh, and over a period of next 4 weeks, after 4 weeks, it was escalated to 5 milligram once a week. Patient does not experience any major adverse event except reduction in the appetite and fullness. Lifestyle intervention were advised, more specifically low carb, high protein diet and resistance exercise. Resistance exercise is very important as we was discussing about this muscle loss, particularly in these patients. So that becomes very important thing. But you see the results in these patients were exceptional. I would say exceptional because it is unusual. Don't expect this kind of a result in each and every patient. April 25, weight was 82.5. June, it came down to 70.8. And by the end of the September, she had 63.6 kg, almost 18, 19 kg weight loss over a period of 5 years. These are the exceptional results. As we discussed in the type 2 diabetes, usually you don't get this much of a weight loss. And again, HbA1c reduction from the 7.2 to 5.6, almost in the non-diabetic range. So this patient got an exceptional result, and they had basically what as we are talking about, ideally we should be measuring body composition in these patients to follow how we can follow it. If you particularly specifically look at the bottom part, her weight is 82 point something, and more important is fat percent 43.6 and skeletal muscle mass 25 something. That was in the April 25. If you look at her September data, uh, weight has gone down to 63.6, skeletal muscle mass from 25.5 to 23.2, and body percent of fat from 43.5% to 31.9%. So almost 12% body fat loss and roughly around 2 kg of skeletal muscle loss. We were discussing skeletal muscle loss previously, why this happened and so many things. But I think there is a very simple and logical explanation for this. It may not just be a simple drug effect. It's a very logical explanation. What does the bodybuilders do whenever they are building muscles? They overtrain, overburden their muscles. 10 kg, 15 kg, 25 kg, they overburden and they build muscles. What happens when person is losing weight? Weight is going down. So what is the effect on the muscles? Muscles are not overburdened. Stress on the muscle is less. So that may be the simple physiological explanation that muscle mass is going down. And another important thing is intercellular muscle in the skeletal muscle, intercellular fat, that may be also vanishing and that may be the causing weight loss. So important parameter to track here is muscle strength. And obviously we should be having more studies on that, how muscle strength is going over a period of changing over a period of time. So this patient lost 18.9 kg and out of which 15.6 kg was fat mass and 2.3 kg was muscle mass. And percent body fat improved from 43.5 to 31.9. If you look at the other lab parameters, reduction in the fasting glucose, almost normal range, HbA1c normal range, some reduction in the total cholesterol, LDL cholesterol, HDL cholesterol, almost similar. significant reduction in the triglyceride, and as discussed, some significant reduction in the blood pressure also. And after 5 months, her thyroid parameters were normal because she was on the thyroxine. So basically, this is the ultimate summary. From fasting of 136, she had a fasting of 78, absolutely normal. From HbA1c of 7.2 to HbA1c of 5.6, and weight loss of almost 19 kg. Thank you.